Hey, Dr. Shakib here from Irvine Spine and Wellness Center, your Irvine Chiropractic and Wellness Clinic, where we talk about pain, posture, and movement. Not just talking about it, we take care of it, right, Ian?
We do.
I'm here with Ian, and Ian has agreed to be my model, so stay tuned. Thanks for watching. Let's talk about how I figure out what part of the knee joint is the problem part. So typically speaking, in another video I explain the whole anatomy just for the general rule of if it's on the inside of your knee where you have the pain, it's medial collateral ligament, MCL. These knee issues are typically seen in runners, in cyclists, and people who play jiu-jitsu. Surfing, it's very, very common. And frankly, you don't even have to be active. It's a very non-forgiving joint where issues above or below can end up in the knee joint, and because it's a tight joint, you end up having issues. So let's talk about the knee and how to figure out what structure is messed up. So if it's on the inside, it's medial collateral ligament. So if I grab the leg up and support, this is not something you could do probably yourself, so if you decide to do it or someone else watch this video to learn how to do it, you're on your own. I'm not going to take any responsibility for you hurting yourself. It could be damaging. So what I'm going to do is I'm going to go through a range of motion where I go just like that, and I'm not really pushing into the knee joint in that direction. I'm just going in that direction gently, and I go to the end and I reverse that and I go opposite, because as I go in and in that direction, I'm assessing the inside. I'm sure you feel it. And as I go up and I turn it around, I'm actually doing a little bit of that, assessing the outside. Now, if you have hip issues, that could interfere with the function or that can cause pain. So you kind of got to be careful with that. So that's going to assess the collateral ligaments, if it's really a structure that is damaged or not. Then there's another test that we do where I sit or support the foot, and the knee is lining up with the hip, and I grab the back of the leg right at the knee joint, and I support that leg, and I gently pull the knee or the leg towards me and then away from me. This test shows how the cruciate ligaments are. You have to understand these tests don't necessarily all end up being positive, and yet you can have issues. So every knee problem has to do with improper movement. If you improperly move, you put stress on the structures of the knee, and like I said, the knee joint itself is not as forgiving, so it speeds up. If you have any questions, make sure you ask, call the office. I'll be more than happy to answer your questions. You can ask your questions at the bottom of this video, and visit the website so you can better understand the whole structure of movement, the whole progression of movement, and how you may have knee issues, but your actual cause is elsewhere, and it always is a postural decline. So your posture has to do with how healthy you are, and unfortunately we don't all have to be models here to have better posture. Better posture is necessary for proper movement, and lack of proper movement ends up causing you issues. Hope you enjoyed this video, and thanks for watching.